Materia Medica 360 degrees remedy of discussion today is Borax. One important remedy which is usually considered in cases of aphtha. But there is a lot more that we can consider and find out. The first thing to remember is that in Borax, the whole GIT can be affected from the mouth to the anal region. The whole GIT is affected. Along with that, there are a lot of nervous system symptoms. So we need to be very clear with that. Always remember this sensation. The common sensation amongst majority of the symptoms will be ulcer-like sensation. Ulcer-like, जैसे वहाँ पे कोई घाव हो गया है. So in that case, the patient most probably will be pointing to some kind of a burning. You can see the patient coming with anal burnings. You can see the patient coming with urinary burnings. You can see the patients even complaining of vaginal burning. And of course the aphtha, wherever it is, the patient will come and describe an ulcer type sensation. Now, the ulcers can even be present in the vaginal area, and the patient will often complain of leukorrhea, white discharge from the vagina. This leukorrhea is often starchy, or what we call as membranous leukorrhea, and it also gives a burning pain locally. There is reduced desire for coition in both the genders, but especially in females. And females either will be coming with sterility, along with that the starchy leukorrhea, or they will be coming with starchy leukorrhea where they will say that I get easily pregnant. So they conceive very quick. Now let's talk about some PQRS, important symptom that we must consider. Here I would like to compare with arsenic. This remedy almost always will have anxiety associated with all the complaints. This is how we recognize an arsenic patient. But when we talk about the Borax patient will be in constant worry mode, and they will have an ongoing nausea. Okay. Now, let's see a modality of downward motion, which is how we do remember Borax often in our college days. Here I would like to talk about the pediatric Borax. A child described by mother with certain points that we can remember. Of course, the child will have aphtha, the muँह के छाले, and the symptom will be the child cries while eating, or if it is a breastfeeding child, the child will cry while feeding, and the mother will also tell that the tongue feels so hot, so my breast becomes heated and the child will not feed. In fact, the child can come with urinary burning. So when the child cries before urination, that means the child is having pain and burning. So you can think of Borax even in these cases. Patient develop not only the fear of downward motion. So when you put the baby, the mother will tell you that when I put the baby in the cradle or on the bed, he will start crying. But there is also fear of urination. But another relieving modality is the baby will feel better by passing stool, and often the stool is greenish, loose stool, so green diarrhea with aphtha, hot baby, and the hairs, if you see, are very dry and dirty, tangled hair. One more modality is aggravation 4 p.m. where we often think of Lyco, but it is also a modality of Borax. I have treated a case of psoriasis where Borax was indicated because the patient had the PQRS concomitant, where there was a constant worry with nausea and apathy. So this combination helped me relax the case of psoriasis. So the children or even the adults will be very sensitive to sound, and in childhood we can get a history of some kind of a fear. So the patient is always on the nervous side. I hope this helps. Subscribe the channel. I am coming up with more such basic keynotes that will help you prescribe and make wonderful results in your cases. Thank you very much.